Hi, I'm Deanna Eder with Polara Health. I'm the Director of Marketing and Communications, and today I have two guests with me. I'll let them introduce themselves.
Thanks, Deanna. My name is John Schuderer. I'm a retired mental health and substance abuse counselor, former chairperson of the Suicide Prevention Coalition of Yavapai County, and I currently call myself a suicide prevention advocate.
And I'm Kelly Lee. I'm the program coordinator for the Suicide Prevention Coalition of Yavapai County.
Today we're going to talk a little bit about a hard subject, but an important subject, and we're going to talk about our statistics here in Yavapai County. We're going to talk about an event we did and are continuing to do in our community called My Ascension, and then we're going to talk about the new 988 Crisis Suicide Hotline that's starting July 16th. So John, I think you're going to start with our statistics today.
Yeah, I don't want to bore anybody with a whole bunch of numbers, but I just wanted to bring up a couple of points. One was last year in 2021, we had 74 suicides in our county. 64 of those were males, 10 were females. And we had 2 in the age range of 11 to 18. Our youth are at high risk for suicide. Anecdotally, I'm hearing that there's a large increase in numbers of students and young people coming into ERs for suicide, where suicide prevention, suicide ideation, and depression, that sort of thing. We also have a high number of folks from the elderly range, from 70 to 99. Actually, we had 16 folks die by suicide in that range last year.
Yeah. It's a tragic, right?
Absolutely.
And it's something that we're highly concerned about in our community.
The other thing I always want to point out, too, is that each of these numbers, it's a person. It's not just a number. There's a person and a family and friends behind each and every one of those numbers. So the suicides have a ripple effect throughout the community.
Absolutely. And we do know that if we talk about suicide and suicide prevention, that it is important and to have those conversations, and hopefully we can make some differences. But it doesn't make somebody more susceptible to trying to complete a suicide if we talk about it. If we talk about it, it brings up more options and resources, that type of thing.
Absolutely. And often a person that's considering suicide doesn't know who to talk to. So as folks offer themselves and ask some serious questions about, are you considering harming yourself? Are you considering dying by suicide? That opens the door for them, for the other person to say, here's someone who is willing to listen to what I have to say, because often they don't know who to talk to.
Absolutely. Yes. Yeah. So we did an event at Yavapai College in May, and so Kelly's going to talk a little bit about the event that we did and then what we're going to continue doing in this community around the My Ascension documentary.
So John brought a movie to my attention and to the coalition's attention, and it's called My Ascension, and we're grateful that you found it.
You're welcome.
It's an amazing documentary. So it's a documentary about Emma. Emma survived her suicide attempt when she was 16, and the documentary is recorded pretty much less than 6 months after her attempt, and so it documents her process through healing, through her journey, through what she's learned, what she wants to learn. She took a journey through knowing why she did it, how she got there, how it affected her family, and then what she can do to make a positive impact in her community and in her high school.
Absolutely.
And so we brought the movie to Yavapai College, and we invited the community to come and watch, and we brought professionals to be on hand for everybody in the audience. And it's a very powerful movie. I was fortunate enough to get a preview of it prior to us showing it, and it's very well done. It affects everyone. If you're a parent, it's really hard to watch, but it's something to learn from, and I think it gives our young folks a voice.
Absolutely. Yes. And Emma actually suffered from depression and anxiety and didn't talk to anybody about her depression and anxiety. And in a moment's notice, in a moment of crisis, she chose to grab her father's gun and shoot herself. So she's now living in a wheelchair. She has suffered paralysis in her legs and one of her arms. And so she talks about her process and what she's doing out in her communities now to make a difference.
Yes, and I felt like it was, you're going through the story with her, and you're emotional about it, But then when you see what she's trying to do to learn from it and to grow and to help others, and then, she wasn't just, here's my story. She's, what can we do in our communities? How can we reach our kids? What can we do to give the kids a voice? And bring the Hope Squad,
Yes.
which is a nationally recognized program, peer-to-peer, that high schools can bring into their districts to help kids help other kids.
Absolutely. Yeah. Which is so important. That peer-to-peer relationship is a very important relationship.
If I may jump in just for
Please.
a second, because you mentioned she used a firearm to commit or attempt her suicide, and that's another huge thing in our county. Let me grab my numbers here real quick. Of those 74 suicides last year, 55 of them involved gunshots or firearms, and the national and that. If you do the percentages, it's 74% of our suicides in our county were by firearm. The national average is right around 53%. So you can see the huge number of increase in firearms usage in our county, and that's typical of Western states anyway. But the point I want to make is that it's really important to talk about firearm safety as it relates to suicide prevention.
Absolutely.
And often people will say, well, you're not going to take my firearms. And right now, firearms are a huge, huge topic. And it's not about taking away anyone's firearms at this point. It's about safety.
Absolutely.
And our young people, most of them probably know where your guns are. If you own guns, they know where they are, and they probably know the combination or know where you keep the keys. So change the combination frequently, move the keys. We need to keep firearms out of the hands of young people when they're at risk.
Absolutely.
If they're struggling with anxiety, depression, or suicidal ideation.
Absolutely. Yep. And there's gun locks that are available in our community, and you can lock up the guns separate from the ammunition, which is always
Yes.
a really good idea. So there's lots of different ways that we can remove those potential harming devices. So yes, absolutely.
And maybe taking, a step before that and having conversations.
Yes, absolutely.
With your kids, with
Yes.
your parents.
Yes.
I mean, we have elderly populations, obviously, with these statistics that there needs to be conversations. Yes.
And we actually, through our organizations, purchased the rights to the movie My Ascension. So talk a little bit about how we can get it out to our communities and what we're doing.
Sure. So we decided to bring the movie to Yavapai College. We did a large event, but it doesn't have to be that large. We can do smaller showings for civic groups, for high schools, we can do community events in different locations where we will bring the movie and the professionals to do a showing. It's free of charge. So we bring the movie to your location. We provide it. We will hook it up and figure out how that works. And we can show the movie and then have a little discussion, Q&A afterwards, and have professionals there to support people in the audience. So they can contact me at kelly@communitycountsaz.org, and we can set up a plan to provide the movie showing at your location.
Absolutely. We've got a chance to show it in the last 2 weeks over at the Juvenile Justice Center for the kids that are over there. And I have to tell you, it was very impactful sitting in the room with those kids. And it hit them, and they understood it and related to it. And so just one person at a time. That's all we have to do, right?
Yes. It could be a small group of 10. It could be 200. We just want to share this message because I think there's a lot of things to take away from this movie, especially as a parent or if you work with kids. And it can open up those conversations and allow them to express themselves.
Absolutely. And we're finding that it's probably age appropriate for middle schoolers and above. High schools would be great to show it, or high school kids, even the colleges in the area, I think would be really important to show. So, and have those conversations.
Yeah, my philosophy has always been the more people we have eyes on each other, taking care of one another, we'll get those numbers down.
Absolutely. And we had a conversation yesterday about what's next. So after we get this out in the community and talk in the community, there's some things that we want to start providing to our community as to what's next. And so you'll have to stay tuned for that. But there will be some things going on. Absolutely.
Yeah. So if you have a group that would like to provide the movie and do a showing. If you are a school administrator and you would like to speak with us about showing the movie, we are happy to do that.
Absolutely. Yeah. The other thing that's going on starting July 16th is the new Crisis and Suicide Lifeline. So July 16th, 988 is going to be available. And what that means across our nation is that you have access to mental health and crisis counselors on a phone 24/7. And all you have to do is dial 988. And we'll get you those resources. And the greatest thing about this is that you don't have to remember long numbers any longer. You can just remember that. So instead of 911 for an emergency, you can dial 988 for a mental or mental health crisis or a suicide crisis. And people are highly trained. They've all gone through about 90 hours of training on the other end of the line, and will continue that training. So Solari, who was Crisis Response Network, who handled our 211 here in the state of Arizona, is actually taking over our contract. So it's a watershed moment, as the CEO of Solari says, Justin Chase, and it's a benefit to our whole nation to be able to have access to 988. Absolutely.
I just think it's so much easier for someone in crisis to remember 988 and to be able to pick up the phone and dial that.
It's been a long time coming. For many years, we handed out, little cards with all the crisis numbers on them, and it's like, what number do I call? So finally, we have a single number. It'll get you connected to the right place.
Absolutely.
Now, is this age restricted?
Not that I've heard of. Okay. I think anybody can call, and you can call for yourself if you're in crisis. You can call for a family member or a friend. On the other line, they're able to give resources and safety plans and hopefully de-escalate a situation. That's the biggest criteria, or what they want to do is be able to de-escalate. If we need to send out emergency services to the site where this person is, then that person will be able to do that and send emergency crisis team out. Yes. So super excited about it. We find that so many people, if they just have somebody to talk to, it can change the whole situation.
Absolutely. Yeah. The other thing to remember with the 988, it's not a replacement for 911.
It is not.
911 is for other emergencies, automobile accidents, house fires, whatever.
Yes.
So it's important to keep those two separate so you get routed to the right place the first time.
Absolutely, yes. And what we find too is that if people just have something to remember, it's super easy. You just have it in your head now, 911 or 988. So if you are in a mental or mental health crisis of any sort, you can just dial that starting July 16th. If you find that you want something more local, though, Polara Health has a crisis stabilization unit in Prescott Valley behind Tractor Supply, and you can walk through those doors 24/7. So if it doesn't matter your age, it doesn't matter your crisis, you need a moment away, you need 24 hours to sit in a chair away from a family member or a household, you need a warm shower and a hot meal, you can walk through our doors at our crisis stabilization unit and receive immediate care. And we also do resourcing and safety plans and do follow-up afterwards. So it's a great facility, open 24/7, and again, anything, you can walk through our doors.
Should we maybe address starting those conversations and local resources for parents or for caregivers of elderly and how they can find resources in our community?
Yeah, sure. You're looking at me.
I am.
Wow, to start the conversation, I would first say, and this is one of the things I often share in the presentations that I do, is that family members and friends know you and your behaviors. And so they have good eyes and good ears. And when something starts to change fairly radically, then it's time to start. I always call that a little yellow flag, or sometimes it's a big red flag, to start a conversation, asking questions, and not trying to guilt the other person. Someone might say, I'm really feeling depressed today, or I just don't want to be here anymore. And then sometimes someone might say something like, well, you shouldn't feel that way. That doesn't work because they're feeling that way, obviously. So a better question might be something like, well, tell me a little bit more. What's going on? What are you struggling with? And just try to validate what that person is going through. That goes a long way, too. And based on where the conversation goes, then you can ask that question, are you considering harming yourself? I always suggest asking the much tougher question, are you considering killing yourself or taking your life by suicide? That's much more direct rather than harming yourself, because that means a lot of different things.
That's a hard question.
It is. I just had a conversation with a friend yesterday who has another friend who's elderly and isolated, and I said, do you have it within you to ask him that question?
Yes.
He says, gosh, I don't know.
But then you have to be willing to ask the question, but then you have to be willing to listen to what happens.
You have to hear the answer.
Yeah.
And that's scary, obviously. I remember as a therapist, the first time I asked a client that question, it's like, don't tell me,
Yeah, what's the follow-up?
Unfortunately, they weren't suicidal, but it is a scary question.
Absolutely.
And so I often suggest people practice that with their family members, even if they're healthy, or especially when they're healthy. Just ask those to practice.
Yes.
So then based on what those responses are, then you can say, well, how can I help you? What do you need right now? And it might be something simple as just listen to what I have to say. Often now with kiddos and parents, that's a much tougher thing because the emotions are interlaced with the relationship. So sometimes I offer or suggest that young people talk to maybe an aunt or an uncle or someone that they trust if they can't talk to their parents that way, or find a trusted adult. And then the adult doesn't need to worry about being a therapist. It's just about knowing what the resources are to get that person connected to the help that they need,
Absolutely. Yes.
the appropriate help.
And I know that on the Suicide Prevention Coalition website, there are signs and symptoms. There are local resources and national hotlines, which we will have to update next month. So that could be a resource before you have those conversations, just to be prepared.
Yes, to know where they are.
Yes.
Absolutely. Yeah.
Be prepared.
Be prepared.
Yes.
Know what your resources are, or know who to contact when those crises happen, because you don't want to be scrambling and digging for phone numbers or locations, that type of stuff.
right.
Yeah, absolutely. Well, anything else we want to cover today?
Our events that maybe we have coming
A couple
up.
of events, yes.
Yes.
Thank you for reminding me of that. The two that I want to mention, they're not ours, but they are well known across the state of Arizona. First one is the 21st annual Arizona Survivors of Suicide Day Conference. It's in August 6th, 8 a.m. to 3 p.m. I've been to this conference multiple times. It's always well done. This is for folks who have lost someone to suicide.
Yes.
Or I think they even allow folks to come in who have attempted suicide but are still with us. So it's always a wonderful thing. There's usually experiential activities to keep it flowing. And then in October is our state Suicide Prevention Coalition Hope Conference, not to be confused with the
Hope Fest.
Hope Fest.
Yes.
This is the Hope Conference,
Yes.
October 13th through 14th. Both of these events are down in Phoenix. We can get the information out there for you. The Hope Conference is also always well done. I think this year they have three speakers that are always excellent, and there's lots of resources there as well. So hope you'll spread the word and get those out there.
We also have a walk, and I think it's
yes.
October time, and it's Walk Out of Darkness. And it's a local event. Last year it was at Granite Creek Park. I'm assuming it'll probably be this year also. But we'll also be pushing that. It's a great event to come together with people who have similar stories
Yes.
and similar loss.
And that one is a fundraiser for the American Foundation for Suicide Prevention. So folks that walk are encouraged to go out and get donations and help continue the research in suicide prevention.
Absolutely. Great.
And I think we'll have these events on the Suicide Prevention Coalition website. Polara will also have those, and then we can share those on our Facebook pages as well.
Absolutely. So if you want additional information, you can go to our website. It's polarahealth.com. Also, our main number coming into our whole organization for mental and behavioral health is 928-445-5211. And then the Yavapai Suicide or Prevention Coalition's website again is?
spcyavapai.org.
Yeah.
Yeah.
And we can actually put those on the screen.
Yes.
So great. Well, we thank you for your time. Thank you for joining us today. And if you have or need any resources, please reach out to any of us.